good afternoon, good morning, whenever you're watching this. I don't know. Whatever. Anyways, today I'm doing something very interesting. I am going to get a acupuncture done to my face. I believe it is a Japanese facial acupuncture, a Japanese acupuncture facial. Anyways, yes, so I'm getting a facial done, but it's with needles. So this will be very interesting, and I thought that it would be kind of a fun video to kind of see how it's done, talk to the doctor about it, and see also what else he offers. What I am doing it for kind of like lines and preventative stuff that we've talked that, you know, I've done a video right here on like facial patches and things like that. So I'm very interested in things that are anti-aging, but not necessarily like full-on like cosmetic procedures. I will take you along with me, and I think this will be a lot of fun. So we'll see you there. Alright, so we are here with Dr. Carlos Chapa, and he will be doing my acupuncture today. So I had a little bit of questions about acupuncture. So I know it's not limited obviously to the face. There's different types of acupuncture, and what are the benefits of acupuncture?
Well, that's going to take a few hours to talk about the benefits overall. But you know, what amazed me about acupuncture is the wide range in usages. Meaning I can treat somebody for, like, say, migraine headaches. We can use acupuncture for allergies. We can use acupuncture for energy, hormones. So pretty much you name it, there's a benefit that can be with acupuncture. However, today we were talking more
cosmetic. We are doing cosmetic. So I did have a question about cosmetic. So how does this different from other like cosmetic procedures, kind of like a dermapen, where those are needles as well, but it's different, right?
Correct. So my mentor, Dr. Takeshi Kitagawa in Tokyo, Japan, this is all he does. He just focuses and treats cosmetic acupuncture, mostly the face, and we use it for a wide range of things such as wrinkles, little circles, tightness, firming, and of course the more serious stuff, cosmetic-wise, like facial paralysis, like Bell's palsy, say some type of asymmetrical issues as well. How does it differ than Botox and things like that? Once again, we're not anti anything, but you know, Botox once again does have side effects, where for the cosmetic acupuncture, most of the time people are not going to be running up to you and asking you, what did you do? It's more subtle, and I think like anything cosmetic, that's where I think that's the best part of it. It is subtle.
Yeah.
It's safe as long as it's by someone that's properly trained. To be an acupuncturist licensed, you need at least a 4 years post-medical degree. Depending on your state, there's a lot of doctors, nurses, chiropractors, and even physical therapists that can use a needle, and they can call it acupuncture or dry needling. And like I tell most people, there's nothing wrong with that, but it all does come down to the training.
And you've trained in Korea, China, and Japan?
And Taiwan, and a little bit in Singapore. And this is my passion. So, I mean, my degrees are my degrees, but most of the things that I learned, the best lessons I've taken, I got no continuing education for, but I got to travel abroad and see what they do over there, which just, like I said, is mind-blowing.
Cool. All right. So how does acupuncture work?
For cosmetic, specifically, we're going to use very, very, very tiny needles. These are 0.10, which means 0.1 millimeter. Okay. What does that mean?
Yeah.
Maybe 3 or 4 of these equal 1 hair.
Oh, wow. Okay.
So, and we're talking about the diameter. So whenever we take out the blood, for example, there's usually an 18 gauge or 20 gauge. I can put almost 40 of these needles into the bezel of one regular syringe.
So this is like
this is as thin as it gets. I don't even think the camera's going to really pick it up.
Okay.
So unless we get really, really close. But what we're going to do is we're going to put this in cosmetic acupuncture. We're going to actually stimulate the collagen and white blood cell response. So unlike Botox or something that's going to paralyze the area, we're just going to try fill this in.
Okay.
So it usually takes a few sessions.
Okay.
So one session is usually not enough.
Right.
I usually tell patients give me a good 5-8 sessions around there, and then we'll compare with pictures up close, and then that's when the patients start really noticing a difference.
Okay.
So today you want to focus on what areas?
So mostly for me, I have like forehead, just some lines.
So when we're going to, first we'll go a little superficial, but like I said, that's when that's what it's going to take. So we're going to work, you said a little bit here. Raise your there you go. Relax a little bit. And we're going to just go as very, very, very superficially. And some of these guys you're going to feel a little bit more than others.
Okay.
And the problem is when they're too thin, it doesn't go in as easy. So. Does it hurt?
No.
So I'm going to go right here. You see a little bit of the smile lines. Some patients come, if they're aggressive, they'll come once a week. If it's a maintenance thing, they can come every 1 or 2 months, believe it or not.
Okay. We've let myself marinate. So now we are taking them out.
Yes.
All right.
So this is the fun part.
Okay.
There's really nothing to it. So we just take it out. And these guys are so thin that there's really nothing.
Yeah.
I mean, you hardly ever bleed.
Wow.
We have to be careful, of course, with, nicking a little capillary or something like that. But in general.
So we just finished taking everything out. And honestly, like, there's hardly any redness or anything. Yeah. So I just want to thank you, Dr. Chapa. He is here in Irving, Texas. Yep. So you should definitely, and like I said, he treats everything.
Yeah, I mean, if we can't help you, I'm sure we'll find someone that can.
Yeah,
so definitely.
So any issues, anything, I'm sure I probably should have been coming a long time ago, honestly. But so thank you so much.
No problem. And, thanks for coming.
Yeah, and I guess I'll check back in later.